It's really hard to define accompaniment because it's such a personal term, and I feel like everyone defines it in a different way. It can mean a variety of things, from meeting someone at the airport to being with them when they get out of surgery.
One of the things I think is really challenging about accompaniment is that sometimes it really is just walking with someone and being there with them. And they can be going through something that's really difficult, but you can't always really do something. You're just sitting there with them and trying to provide support in the sort of mental and moral sense.
As soon as people walk in the door, I make them know that this is their house. I always make myself available. Like if there is a surgery, I would be there until the patient gets inside the room and put to sleep. Then I would go to work. So I really, I think, go out of my way to make them feel as comfortable as possible.
My role within the Right to Healthcare team really has to do with breaking down bureaucracy and navigating processes. And in that way, I accompany our patients. It could be something as simple to us as scheduling a medical appointment, or something a little more complex, such as applying for an immigration status.
That the job doesn't end at 5 o'clock. You know, you're doing things all the time for your patient and communicating with other people by email, and try to help things happen. And that's been one of the most eye-opening things for me. I mean, sort of in theory, you would know that before you started. Obviously, well, your patients will have needs after 5 o'clock, but it's been a whirlwind. Like, oh, okay, yeah, this is what I'm doing, and I love it, and my patients need me all the time.
Always, it never fails. The emergency will come between 10 and 2 in the morning. So then you have to run to the emergency room.
Especially in Right to Healthcare, where you have little children who are coming here and are having this really scary experience of going through medical care, coming to a new country, not speaking a language, just layer upon layer of difficulty.
The challenges, really, I think the reward are greater than the challenges that we find.
I always try to remind myself that one of the worst things is really going through something alone. And even though you have to go through this difficult situation, it's always great to be able to at least have someone there to be with you.
I don't think anyone as a clinician knows everything, knows how to deal with every situation. And I think you're always going to need some help along the way.
We as a team are also accompanied by other partnerships. For example, when navigating immigration status, I'm not a lawyer, I don't know anything about that. So we have a law firm that helps us navigate those systems, and that takes place in a lot of different things that we do.
And those doctors, I can't say enough about the doctors, because the way they are, it's like they're treating their own kids. It doesn't matter what they look like, where they come from, and I have a bond with them, what they put in, really, and that encourages me too, in what I'm doing.
So each patient is a new experience to learn something different, either about medicine itself, about the biological parts of medicine, or just about the social aspects of medicine.
I had that little girl, all blue, and she couldn't hardly take a few steps. She would say, oh, wait for me, wait for me, wait for me. And then she would take a few steps. And then after her surgery, to see her blooming and running up the stairs, yes, it's worth it.
When you see success with a patient, it's definitely something that's just thrilling in a way that you can't experience in any other part of your life.
The best part is the reward, really. Seeing the patient when they come and the difference when they have to go back home. It's just awesome. It has to come from your heart. It's like being a nurse or being a doctor. It has to come from your heart. There is no money that can pay for that, for the love that you have to put in it.
I love the work, and you can't do it without loving the work.
that's your priority. That's this patient is your priority. The appointment, the medication, you have to make sure they take it. So
It's definitely a privilege to be able to accompany and to be in a position to be able to help the patients that we are able to help.